As we continue our coverage of the protest in Madison and across the country, it's important to remember there is still a deadly global pandemic going on.
In addition to our weekly talks with Dr. Zorba Pastor, we're also going to be talking to Dr. Jeff Pothof from UW Health a few times a month just to check in and see where things are and maybe answer some of your questions. And Dr. Pothof joins us now. Hi, welcome to Live at 4. Good to see you.
Thanks for having me on. Appreciate the opportunity.
No, and we appreciate you being here. Let's talk a little bit about the protests that have been going on in Madison that have been pretty densely packed. Some people wearing masks, but not everybody. What impact do you think the protests could have on COVID-19?
Yeah, I think the protests could have an impact on COVID-19 cases. We're a bit in uncharted water where we don't know exactly what would happen, but the science would say that if individuals are in close proximity, which they are, and are unmasked, which many of them are unmasked, and doing things that generate much more droplet, which is the infective component that gets other people infected, and things include, yelling and shouting, increase the amount of droplet we make. We would see COVID-19 being able to transmit between people at these protests, given all those factors.
And they're going on all over the country, so we could see an impact, in a couple of weeks perhaps?
Yeah, anywhere from 10 to 21 days is usually what we look for as far as incubation period, plus the time that it takes people to have severe enough symptoms where they would get tested, and then the time for people getting tested to the time that test comes back. All those add a little bit of time. So that's when we are kind of looking to see if we see an increase in cases, both in Wisconsin but around the country as people do these protests.
Does it help that they're outside at all?
It does help that they're outside. We know that that's a better environment than being indoors. So that's one thing that we do have going for us as it pertains to these protests.
There seems to be an impression among some people that the worst may be over here, or that at least we're in a period now where we can exhale a little bit. Is that in fact the case?
I would love to say that's the case, but not really. I think there's things that we don't know about COVID-19, but if we look at other pandemics, and influenza is probably the one that most similar to COVID-19, there's almost always a second wave. And I think we'd be remiss if we didn't worry about a second wave with COVID-19. So important to keep our guard up and do the things that we need to do: physical distancing, wearing a mask, good hand hygiene, even when it may seem that COVID-19 is the story of yesterday and there's more exciting things going on right now.
If you have no symptoms, should you get tested at all for the test?
It's interesting, for people who are at these protests, it wouldn't be necessarily crazy to think that, 5-10 days later, they may consider going to get a test to make sure that they aren't carrying the virus. I think the concern is that there's a large proportion of people who don't have symptoms, and if they had the virus, it would offer us an opportunity to potentially do some contact tracing to try to not have this be as big of a spike as it could be.
So tests are readily available now. If you want a test, you can get a test. And do you think you should get a test?
I think it's a good idea if you're out protesting and you're close to other people yelling and shouting to consider getting a test to see that you didn't contract the virus. Because if you did contract the virus, we might be able to do some of that tracing and get ahead of it before you end up infecting a whole bunch of other people. Although at the same time, how are we going to possibly know who you were all in contact with when you were out there? So it could be tricky.
What about the antibody test? The results are sort of like 50-50 effective with this.
Yeah, you have to be careful about the antibody test. There are some tests out there that aren't all that sensitive. Here at UW Health, when we looked at the different tests, we did pick a test that has very good test performance. It's a good test. I think the other thing, though, that you need to realize about antibody testing is that even a very good test, if the percent of people in a population that have the disease is very low, even that small margin of error in the test can be amplified, and it's not as helpful, especially as we look at positive tests.
People have been putting out some elective medical procedures. They should go ahead with those now, right?
Yeah, early on, I don't think healthcare systems had in place the processes that are needed to keep patients safe. Physical distancing was a brand new thing. We were worried about PPE supplies. We didn't have robust testing infrastructure. A lot of that has changed, and we've heard a lot of stories of people who deferred their medical care, who then had a less than desirable outcome because they did that. So we've worked really hard, and the other health systems in town have worked really hard to ensure that if you have healthcare needs, it's okay to get those, whether it's the emergency department or urgent care, or even your primary care clinic. For those visits that maybe aren't so easy to do virtually or via video, we have processes in place that allow those to happen safely, whether it's screening or masks for you to wear, ability to keep you separated. All these things are in place that make it safe to get your medical care at this point.
All right.
Well, Dr. Pothof, we're looking forward to this being a regular segment. We kind of jokingly around here call you Madison's Dr. Fauci. You've been at the forefront, and that's a very high compliment to give you. You've been at the forefront of this. So we really appreciate your help, and we're looking forward to our next segment with you.
Stay well. We'll
Thank
talk
you.
to you soon.
Thank you very much.
I look forward to it too. See you later.
Final check of your forecast is coming up.